Before you reach for that metformin prescription, pause and inform yourself. This crucial medication for managing diabetes is surrounded by myths and misconceptions that could impact your health choices. Tune into our enlightening discussion to debunk common misunderstandings and explore vital information every patient should know. Don't take another pill until you've watched this. Your journey to effective diabetes management could take a promising new turn. Number 1. You will gain weight on metformin. The myth that metformin definitively leads to weight gain is widespread but inaccurate. In reality, metformin is often associated with weight stability or even weight loss rather than weight gain. This is particularly significant because many medications used in the management of type 2 diabetes, such as insulin and some sulfonylureas, can indeed cause weight gain. Metformin works by improving the body's sensitivity to insulin and reducing the amount of glucose released by the liver, which can help manage appetite and potentially reduce weight. Clinical studies have consistently shown that when patients with type 2 diabetes start on metformin, they are more likely to maintain their weight or lose weight compared to other diabetes medications. Therefore, it's crucial for patients to understand that metformin, unlike other anti-diabetic drugs, generally does not contribute to weight gain. Number 2. Metformin can cause severe harm to your kidneys. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. The belief that metformin can cause severe harm to the kidneys is a common myth that needs clarification. Metformin is generally considered safe for the kidneys under normal circumstances. The primary concern is that in patients with pre-existing severe kidney disease, metformin use increases the risk of lactic acidosis, a rare but serious condition resulting from the buildup of metformin in the blood. However, this risk is primarily associated with those who have significantly impaired kidney function. For most patients, metformin does not harm the kidneys. In fact, the medication can be beneficial in managing type 2 diabetes, which itself can lead to kidney damage if not controlled. Regular kidney function monitoring is a part of diabetes management, ensuring that metformin remains a safe option. It's important for patients to have a realistic understanding of the risks and benefits, discussing them with their healthcare provider. Number 3. Metformin is only for diabetes. The myth that metformin is used exclusively for diabetes is not entirely accurate. While metformin's primary indication is indeed the management of type 2 diabetes, where it helps lower blood sugar levels by improving insulin sensitivity and decreasing glucose production in the liver, its use extends beyond this. Metformin has also been prescribed to treat polycystic ovary syndrome, PCOS, a hormonal disorder that can cause irregular menstrual cycles and insulin resistance. In this context, metformin helps to improve insulin levels, which can promote a more regular menstrual cycle and reduce symptoms of PCOS. Furthermore, due to its potential effects on aging and metabolism, metformin is currently under investigation in various clinical trials exploring its benefits in cancer prevention and longevity. This broad range of applications highlights metformin's versatility beyond merely treating diabetes. Number 4. Metformin immediately lowers your blood sugar. The myth that metformin immediately lowers blood sugar levels is a common misconception. In reality, metformin does not work like fast-acting insulin or other quick-response diabetes medications. Instead, metformin acts gradually to decrease the liver's production of glucose and improve the body's sensitivity to insulin, which helps lower blood sugar levels over time. Metformin's effect on blood glucose levels is typically seen over a period of weeks rather than immediately. Patients often experience a steady improvement in their blood sugar control after starting metformin, with the most significant effects noticeable after several weeks of consistent use. This slow and steady approach helps avoid drastic changes in blood sugar levels, providing a more stable and sustainable method of managing type 2 diabetes. Understanding this timeline is crucial for setting realistic expectations and for effective long-term diabetes management. Number 5. If metformin doesn't work for you, your diabetes is severe. The belief that if metformin doesn't work for an individual, their diabetes must be severe is a myth that simplifies the complexity of diabetes management. Diabetes is a multifaceted disease, and its treatment effectiveness can vary widely among individuals due to different underlying physiological factors, genetic variations, and coexisting health conditions. Metformin primarily works by reducing glucose production in the liver and increasing insulin sensitivity. However, if a patient's diabetes is more influenced by factors that metformin doesn't directly address, such as insulin production deficiencies or extreme insulin resistance, they might not see the desired effect. This doesn't necessarily mean the diabetes is severe, rather the treatment needs may be different. It's essential for such patients to explore other medications or treatment combinations with their healthcare provider to find the most effective approach for managing their specific type of diabetes. Number 6. Metformin causes harmful vitamin deficiencies. The idea that metformin universally causes harmful vitamin deficiencies is a misconception, though it is based on a kernel of truth concerning vitamin B12. Metformin has been associated with a decrease in vitamin B12 absorption in some individuals, which can potentially lead to a deficiency over time. This deficiency, if left untreated, can result in symptoms like fatigue, neuropathy, and anemia. However, not everyone who takes metformin will develop a vitamin B12 deficiency. The risk can vary based on the dosage, duration of use, and individual patient factors. Regular monitoring of vitamin B12 levels is a preventative measure often recommended for long-term metformin users. If a deficiency is detected, it can usually be easily managed with dietary adjustments or supplementation. Thus, while it's important to be aware of this potential side effect, it is generally manageable and does not occur universally among all metformin users. Number 7. Metformin is not safe during pregnancy. The belief that metformin is categorically unsafe during pregnancy is a myth that doesn't fully align with current medical understanding and practice. In fact, metformin is often used during pregnancy to manage conditions like gestational diabetes and polycystic ovary syndrome, PCOS, under careful medical supervision. Clinical studies have shown that metformin can be a safe and effective option for managing blood sugar levels in pregnant women, with fewer risks of hypoglycemia compared to insulin. Moreover, it has been used to help reduce the risk of developing gestational diabetes in women with PCOS. However, the decision to use metformin during pregnancy should always be made on an individual basis, considering the specific health profile and needs of the woman. Continuous monitoring and consultation with healthcare providers are essential to ensure the safety and health of both the mother and the fetus. Before starting metformin, it's crucial to separate fact from fiction. Our detailed discussion clears up common misconceptions, ensuring you make informed decisions about your health. Watch, learn, and take control of your diabetes management with confidence. Don't miss out on empowering yourself with the right knowledge. You might also want to watch this video on other metformin myths diabetics should know. And please subscribe to this channel if you found this video helpful. Thank you for watching.